As Freddie Howe, my colleague, will say in more detail tomorrow when he is speaking, the NHS is more than just a means for improving the health of the nation. It's an engine for economic growth as well. National Health Service is the world's largest state-funded provider of healthcare, and it has a worldwide reputation for healthcare. Excuse me. That reputation, I know we all want to see continuously improving in the years ahead. That it's not just that we are envied for the social equity that comes from everybody having access to the NHS free based on their need, but also that we are envied for the excellence of what we do, and that we will be envied for the innovation that we bring to what we do. And that, I think, will make a dramatic impact also on the economic impacts of the NHS. I think part of it will be the NHS starting to look into new opportunities, including new opportunities to work across the world. We know some do already, Moorfields Eye Hospital with their facility in Dubai, or Imperial College with their work in Abu Dhabi. We are going to see new commercial opportunities for the NHS, organisations that are delivering not only the best care through the NHS, but because they are seeing the scope of what they do constantly widening, indeed having a global reach, will be able to do more and better for the NHS in this country as well. We have hospitals and healthcare providers and clinicians with a worldwide reputation, and that can bring not only patients and resources to this country, but it can enable us to be out there across the world earning for Britain. So it's not only innovation that matters, it's about the adoption of innovation, it's about a health service that takes up those ideas and makes them happen for patients. That's why we're supporting translational research. It's why we're supporting promoting Healthcare Innovation Expo. So those ideas from around the world and those ideas that are generated here in Britain can be given the best possible showcase. So wherever you come from, whichever organisation you represent, I hope you have an enjoyable and a really valuable time here at Expo. Whether you're a provider of NHS services, I hope you take the ideas and technologies here and spread them around the NHS for the benefit of your organisation and for patients. If you are here to help provide those healthcare services with new technologies, new techniques and new innovation, we're glad to have you here. We're keen to see what you are doing. We want to see it adopted for the benefit of patients through the NHS. Under one roof today, we have the future of healthcare and the future of technology to support healthcare and how innovation can support all of us. It's a very exciting opportunity. It doesn't happen every day. When you come to Innovation Expo, it's going to happen for 2 days. I do hope you all have an opportunity to make the very most of it. Thank you very much indeed.
Andrew, thanks very much indeed. And we'll take some questions in just a few moments. If any of you have any questions you'd like to put to the Secretary of State. But Andrew, can I just start off with one? I mean, obviously today is everything to do with innovation. Everywhere you look, everywhere you walk, there is innovation around you. And out there in the country, we know that there are hundreds, maybe thousands of organizations on the medical side, on the corporate side, on the local government side. They're all trying to do different things in different ways. They've all got new, small microcosm ideas. How do you guarantee to them that you have got a totally non-bureaucratic system within a Department of Health that, you know, has been noted for a certain amount of bureaucracy in the past? How do you guarantee to them that they will get a fair hearing for what they are trying to do to innovate and change the NHS?
Well, Martin, let me give you two quick examples. I've been involved with the development of stroke care for pretty much all of those 8 years that you were talking about. If you go back about 5 years ago, 6 years ago, it was perfectly obvious around the world, if you looked at the leading healthcare systems, that thrombolysis for stroke, following immediate CT scanning, treating stroke as a medical emergency, was far and away the best response to stroke. It wasn't happening in this country. There were people who were leading it, like Newcastle who were developing the FAST process literally several years ago, but it wasn't being adopted. And this is one of the most confusing things, that people said, look, here is this thing called the National Health Service. It ought to be possible for the National Health Service to look at what is working in anywhere across the globe and say, we should all do that, write it down on a piece of paper, send it out to the NHS, and everybody goes and does it. But it didn't happen. It wasn't happening. Because actually, the NHS was behaving like one of those very large convoys where everybody has to travel at the pace of the slowest ship. Why should somebody be the first mover? Because the first mover there was no advantage for doing so if everybody stuck together in the middle. And they literally waited for the Department of Health to produce the National Stroke Strategy that then in effect gave everybody permission to do something that the clinicians out there, the stroke physicians knew was the right thing to do. We've got to get out of that. We've got to get to the point where people are looking at what delivers the best outcomes, and they're looking at the data from a peer-reviewed study in America that says if you do this, you get a much better result. And they go, well, we'll do that then. And who's to tell them not to do it? Because if you're a foundation trust running yourself, if you're a set of general practice commissioners who are commissioning for services, you look at the data, you look at the evidence, you look at what works best. There's nobody to tell you not to do it. More to the point, there's no need for you to wait around waiting for somebody to give you permission to do it.
But to what extent will you in the Department of Health mandate everyone to do something that you think is a good idea? And to what extent, given the competition that we can see out here, different ideas from different companies coming up with different systems,
you can't mandate innovation.
So could one surgery pick up a particular kind of corporate innovation, whereas another surgery is doing it totally differently with another organization?
Well, variation can be very good and very bad. We know there is variation in performance in the NHS. We know there is variation in provision. We published the Atlas of Variation just before Christmas, and people can look at it. For the first time, they can look at that variation. But actually, positive variation, people who do things differently and do it better, is the means by which you advance. So what we've got to do is we've got to promote positive variation for improvement. And of course, what you do by that transparency at the same moment is you expose negative variation where people are not getting the quality they should be looking for. My mandate to the NHS, which it's called the mandate that the Secretary of State will set, will be about outcomes. That we're looking at ourselves relative to the leading healthcare systems across the world and saying, what results should we be achieving for patients? What cancer survival rates? What recovery after stroke? To what extent are we able, for example, to be confident that people don't have emergency admissions with long-term conditions? We should look at the data. We should say, what is the best standard we should be achieving across the world, mandating for that. How it's achieved, then, is not going to be something we can mandate or should mandate. It should be something that is supported by quality standards inside the NHS, but then the improvements in quality are driven by the opportunity for clinicians to get together. I couldn't tell you, Martin, how often I've been with groups of people working in general practice, sometimes together with people from the hospital, who said, it used to be the case, GPs used to have freedom to refer, they used to be able to ring up their counterparts in the hospital and say, why don't we do this differently? And they pretty much the following week could start doing it differently. Now the system has been recently, if they wanted to do something differently, they have to put it through a primary care trust committee system, and it's 6 months before they arrive at that point.